We recently had a situation where we had a patient who came to us because their drug costs were too high. They weren't even our patient. We don't even know where they're a patient at. But we put them in contact with Jeff Twig, our clinical pharmacist. And Jeff sat there and made some changes that would save the patient over $2,400 a year, just minor changes, okay? So, I mean, these are real impacts, real things that we can do by taking that little bit of time. Pharmacists provide health care in a number of different ways. So right now, the shift is being from a dispenser more to providing more cognitive services. I think what we want to do as a pharmacist is try to educate the people, all the different patients as far as how to take their medication and their disease state. And I think at the same time, we would just want to make sure that we increase their quality of life. And I think that's where pharmacists step in, is that we can have a positive impact in the patient because we have direct dealings with them. Pharmacists to have provider status would be huge. Number one, it would give us a seat at the table and being part of the healthcare team. There's a tremendous amount of opportunity because with the Medicare Modernization Act, there has to be medication management that occurs. What they don't specify is whether it's done by a nurse or whether it's by a pharmacist. And I think it gives us a chance to sit down at the table and be able to articulate to them the value that pharmacists, because really, I mean, we're the drug experts, and we're the ones that need to be able to articulate that not only to the team players at the table, but also to the patients in mind. So I think provider status is huge.